I'm going to teach you how to do GTube Care. There's two different techniques. I'm going to teach both ways so that you can practice them. So the first thing you're going to do is hand hygiene. And then we're going to put on gloves. And make sure that you have all your supplies gathered. So the supplies are going to be Q-tips, a washcloth with soapy water, mild soap for cleaning the site, sterile water, and medicine cups, little med cups. So I'm going to just gather the last of my cups and everything. So what I usually do is I put 2 med cups out, and then I get my Q-tips. For GTube Care, you do not have to use the sterile Q-tips that are all enclosed in their own packaging. You can use just regular Q-tips. I'm also going to have this has been pre-moistened with just water, but I'm going to have a washcloth here too. And I want you to practice both types. You use the Q-tip for G-tubes that are new, I would say less than a month old. And because then a Q-tip, you can just be really gentle with that fragile skin that's still healing. If it's an older, well-healed G-tube site, then you'd use a washcloth and just wash around that stoma. So I'm going to show you both ways. We're going to see little Danny, and I want you to talk to him as if he's your patient, and you're going to be telling him what he's going to have done to him. And he's only 15 months old, so I would just say, okay, I'm going to clean that little tube on your tummy, okay, Danny? We're going to check for his ID band, make sure that this is the right patient. Expose the Mickey site. And the first thing you do is assess the skin around it. What does it look like? Is it excoriated? You can move this up and down real gently to see the skin underneath. You're looking for bleeding, signs of infection, edema, anything that looks abnormal. We eventually want to see this G-tube stoma look beautifully healed like a belly button would, just regular skin. It should not look red in any way. Okay, so let's say this is a well-healed G-tube site, then we can just use the soapy water on a washcloth. And so what I would do is just on one part of the washcloth, have a little bit of soap on it, just like 1 drop. And then the other side is still wet, and you can use one side to wash and then one side to dry. So I would gently tilt up the Mickey, and I would start washing. And then on the other side, tilt up, tilt down and wash. And now we have to get that soap off. So on the clean, moist area of the washcloth, you're going to tilt up again and just clean that soap off and any dried drainage that you might see, and then tilt down and do the other side. Okay, now we want to make sure it's going to be very, very dry before we're done. So I left part of this washcloth dry, and so then I can just use the same washcloth to dry the site. Okay, and that's how you do GTube Care with a washcloth. Now I'll show you how to do it with Q-tips. Let's say this is only a week old. What I do is I put 2 Q-tips in each cup. And I fill the cup with a little bit of water. The water will hold it from falling over, which is good. And then one of them will become your soapy water. And so just put, again, just 1 drop. We don't need very much soap at all. You just swirl it around. Okay, so then you're going to start with the soapy water. And you'll have 2 Q-tips, 1 for the top half, 1 for the bottom half. So we'll start on the bottom half, and you tilt the G-tube up, and then you twirl. I don't know if you can see me twirling, but we don't scrub back and forth on a fresh G-tube site or a site that looks like there's problems with it. We have to be real gentle. So we would just twirl it and rotate it. You want to get it right up next to that tube that's going in there, okay? And then you'll take the other clean one and you're going to do the top half by twirling and rotating it, okay? Now we have to rinse all that soap off. So take your next 2 Q-tips, tilt the G-tube up, twirl all that soap off, get it right next to the tube. And then tilt down and you do the same thing on the top half, twirling and rotating. You use very little soap and water. The last thing you're going to do is you have to dry it. And so you're going to take dry Q-tips and do the same thing in a rotating, twirling motion on the top and on the bottom. Okay? And that's how you do it. It's really simple. It doesn't take very long. Some G-tubes have dressings, and those would be an ordered thing. A lot of the new Mickeys, they don't have dressings at all. In fact, dressings can hinder some of the healing, but you'd have to check with your orders. This little guy doesn't need one, so we would not put a dressing on him. Okay, a GTube Care happens twice a day at the very minimum, BID. And more often, if there's more drainage, you're going to have to do it more often, even up to every 4 hours, 3 or 4 hours if there's a lot of drainage being produced. So just so you know that as well. And that is how you do GTube Care.